I just wanted to say thank you to everyone for joining us for this conversation, and to Daniel and Rachel for being willing to have it with me. It kind of came up because all of the conversations that are happening on LinkedIn and in podcasts and on Facebook groups between therapists. AI is a big deal in every industry, including our industry. And on top of questions like privacy and encryption and all those things, there's also a lot of philosophical conversations that need to happen that I've been lucky enough to have with many therapists, and wanted to just kind of host kind of a deeper conversation with it. So just to start, I just wanted to give both of my experts just the chance to introduce themselves. Daniel, you want to start?
Okay, thanks. Daniel, good to see you. Hi. I am Rachel Wood. I'm a licensed counselor. I have a PhD in cyber psychology. Everyone is like, what is that? It is essentially the scientific study of the digitally connected human experience. So that's my wheelhouse, is AI and AI and mental health. I'm also recently the founder of the AI Mental Health Collective, which is bringing together both clinicians and other kind of stakeholders to have conversations like this. So Megan, I'm so just grateful that you invited me. Thank you.
Awesome. And I'll just introduce myself quickly. I'm Daniel. I'm a machine learning engineer. I've been in AI for about 10 years. My dad's a psychologist. My mom's a social worker. So I've been in this mental health world a long time. I did my undergrad in philosophy, focused on philosophy of psychology, postgrad in AI, postgrad research in AI for mental health. I worked at the time with a crisis organization that was helping about 3 million people through mental health crisis, mostly around suicide. The big problem, which is still a problem, is just a massive shortage of access to people who can help. At the time, we were trying to figure out if AI could help. At the time, it could not. The technology just wasn't there. I guess just under 2 years ago, I met my co-founder, Neil, who previously founded Casper. And Neil had the very different story, but similarly had come to this problem of access to any kind of mental health support. And we both realized this has been a problem for a long time. In 1963, JFK gave this address to Congress on the problem of access to mental health care and the problem that there's a massive shortage of mental health care providers. So if it's been happening since 1963 and we're still talking about the same thing today, we probably need a new solution. So we thought maybe AI can finally help with this. And we kicked off this project to build out a model specialized for psychology. We spent about 18 months developing the model. And that was in partnership with behavioral health organizations, with quite a few experts, including Tom Insel, the former head of the National Institute of Mental Health, and quite a few other leaders that have been involved at the time. I would also just give some context. Obviously, I can't speak for everyone in the world of AI, but we've built Ash in some ways very similar to the way that a lot of other technologies developed, in some ways very different. Ash is trained on a specialized data set, so it will behave quite differently. I just want to make sure, for context of this conversation, that I'm not going to pretend to speak for everyone in the world, but the big things are just like, we've focused on building a model that's not general purpose, one that's specialized, one that's focused on being able to challenge people and not just validate people, one that can actually help improve real world relationships. So that's a bit about me, talking quite widely, but you mentioned philosophy. I also had mentioned I did a podcast for a while on AI and philosophy, and that's one of my favorite topics to talk about.
Awesome. Thank you so much. I put out the call to therapists to submit questions for this. I got a lot of responses after prompting. About half of them were just specifically about Ash, and which is not the intention of this conversation. I would be happy to host I don't want to call it a debate, to find a kind, smart AI skeptic to host a conversation with you about Ash. That's not the intention of this, but I did want to just give you the opportunity to answer the most common question I got, get it out of the way, which is, you've described Ash as designed for therapy, but most therapists were asking why the language of therapy when it's not licensed, regulated, or held to the same standards. So how do you answer that concern?
It's a great question. And by the way, funny you mentioned AI skeptics. I think you'd be very surprised that our team tends to be almost entirely AI skeptics, including the people who are working on building the AI. So we are that interesting environment, actually, a lot of the folks here. It's a good question. I think there are kind of two parts to it. The first being, should AI therapy be regulated? Yes. Just to say the obvious thing, like, yes, 100%, of course. We've spent a long time building this, and making sure that we're careful, using a clinically relevant data set, working with experts, developing layers of guardrails. So, I think there's no question from our side that, yeah, there should be rules here. On the question of why it's called AI therapy, it's really funny. have been looking for, we've been constantly looking for, like, what do we call it? For a while, we didn't call it AI therapy. For a while, we call it AI therapy. I would say this is still a big open question for us of what we call it. The biggest things that people come to talk to Ash about are relationship issues, family issues, self-esteem, meaning, self-worth, grief and loss. These are the kinds of, so we've tried other kinds of names. We tried calling it like coaching. We were trying to identify, like, what do we call this thing that applies to a vast swath of the population who are probably not in a category that would be supported by our current clinical system, right? They are not going to have a diagnosable disorder, but they are dealing with the kind of problems that we all have that they could really get some help with. We tried calling it coaching. The problem was that these kinds of problems are quite vulnerable, and it can be really hard to talk about, honestly, some of these vulnerable topics with this very positive connotation of coaching. We tried counseling, but it's not really about giving advice. It's much more about, allowing people to open up and figure things out, develop a sense of their own ability to do things. We tried, it's funny, one big therapist I talked to last Friday suggested emotional concierge. I think it could be promising. It also seems a little bougie. So anyway, I would just say, like, the reason why we've called it therapy is this year Harvard Business Review announced that AI therapy is now the #1 consumer use case of AI. They use the term, like, this is AI therapy usually is like just the thing that people are talking about when they're talking about using ChatGPT to talk about emotional topics. We've struggled to communicate effectively what this thing is. It's obviously very different. It's obviously very different than the thing that, a human therapist can do, where they can actually be physically present and with the person and, share an energy with them in this kind of way that you do. But we also want to make sure that people can feel like they can have that vulnerable conversation, that they don't have to be perfect, that this doesn't have to be about reaching for the stars all the time. Therapy seems to be, the one that resonates with people. I have no idea if we're going to call it therapy in 6 months. I'm not at all married to the term, and I would love any ideas and suggestions from the community.
You heard it here first. Maybe I'll put a post up and see what the survey says. I think that you're describing a pretty familiar idea, which is that there's this space below therapy where there's mental health concerns, but don't necessarily prompt the person to seek a life therapist. I think historically those people have been called friends, but we're going to talk more about that in this conversation and how we can reintegrate community into mental health care and how we can make sure AI is not undermining that. So I'm going to switch. I'm going to give you a little break from talking, Daniel. I'm going to ask Rachel to start with us. Rachel, can you talk just a little bit about what happens in our brains during a therapeutic conversation and how that may be different when we're talking to a human therapist, just kind of like the psychology of connection that we're talking about when we're talking about AI conversations?
Yeah, so let's look at it from the lens of attunement. So emotional attunement is essentially what happens when you're sitting with a therapist. And this is when someone is kind of leaning in to your internal state. And they are showing you or mirroring that they understand you. And you feel awesome because you feel seen and heard and understood. And it is a beautiful thing. And so the way that plays out in the brain and the body is that, first of all, the body takes this as a cue of safety. And so the body can shift out of sympathetic nervous system, fight, flight, freeze, and fawn, and can really move into this relaxed parasympathetic state of, safety. Also in the brain, a number of things happen, Megan, but particularly neurological resonance, which is really crucial for learning. So it kind of amplifies our ability to learn new patterns and, new ways of being. Also, it's going to activate our prefrontal cortex, and this allows us to do things, exercise neuroplasticity, which is that cool thing that allows us to build new neural pathways and understand things in the world in a new way and relate in a new way. So in a therapeutic interchange, this is happening during the interchange, and then also is going to carry over to help build our kind of distress tolerance and our self-regulation as we move on.
And as a follow-up, do we know much about how the brain responds to AI conversations, or is that research still kind of ongoing? Do similar processes happen in the brain, or like what's those interactions like? What are those interactions like?
Yeah, I mean, Daniel might want to speak to this as well. We are seeing studies coming out. Of course, we don't have longitudinal data yet, but we have studies of kind of AI and attachment. And what this is showing so far when we look through the lens of attachment theory is that indeed people are attaching with their own kind of individual attachment style to AI in the same way that they would with a human. Daniel, I'm sure you have some additions.
Yeah, no, I was just going to say we're doing research right now with NYU and with Stanford, and it has been largely to answer this question. So we've had some good early results already, and I could talk a lot about that in terms of demonstrating the effect of Ash in particular, which I wouldn't say is the same as necessarily an AI that's built to be a companion. Like one of the things that was most surprising in our research on Ash was that Ash, or maybe not surprising, but definitely different than general purpose LLMs built to be companions, is the way in which it does strengthen real world human relationships. And so you have this kind of question of like, what is the mechanism? What is happening there? Is it a matter of encouragement? Is it attunement? Are we building a therapeutic alliance in a similar kind of way as you would with a human? I don't want to pretend that we have all the answers. We don't. We're sharing the results as we get them, which is, coming out. Like we're still quite early on this, but a lot of the questions are questions that we're going to need to ask, which is basically like, what are the mechanisms of change in the context of AI? I think it's possible that it's quite similar to a human. I think it's possible that it's radically different. I think we should ask both the question of what is the effect, and if we can show that it is strengthening our social bonds, that's awesome. Whether the mechanism is exactly the same or completely different, but just from the philosophical mind, I am really curious how all that happens. I have no idea about attunement in the context of AI, but I will say that that's an active area of research.
Good, as it should be. Daniel, I am blessed. I've worked with a lot of AI companies, and I've gotten to research and talk and ask all my, uneducated questions. So I feel I have a pretty good grasp on the building of LLMs, but I would love to have you explain how you explain it too, especially even non-therapists, of how it works. And I wanted to note something interesting. I've been browsing I don't know if you know this, there's a AI is my boyfriend subreddit, and people share about their relationships with their AI companion, mostly ChatGPT. But even within that subreddit, there's a strong rule that you're not allowed to ascribe to AI emotions or feelings or free will, even in the way you talk about your relationships. And you can get banned from the sub if you break that rule. These are people who are very supportive of AI relationships, who are very careful to make sure that nobody is saying that their AI has consciousness of any kind, which I thought was really interesting. So could you talk about what's behind this, this AI?
All right. So first, there's the question of what is AI? What are LLMs? I think just on the consciousness, free will points, I could talk about this for hours. So that's maybe a much deeper one. But I would just say, I could easily go on hours just talking about self-supervised learning and the way in which language models are trained. But I think the big important points are language models at their core are trained on an architecture called a neural network, which was a thing that people had posited 50 plus years ago as this like crazy, what if we were to actually try to design a computer system that worked like a human brain? And it was kind of this crazy idea. And I think the shocking part is that it worked, right? Like language models are actually trained with this computer architecture that is modeled after the brain. It's trained on an enormous amount of data. There are actually two stages basically in training language models that we use today. The first is called pre-training. And that's where the model gains its capabilities. You start with like a blank, empty neural network, and then you have it read a lot of data and learn for itself from that data. For most models like ChatGPT, that is the internet that it's basically reading. In our case, we train a little bit differently because we train on a specialized data set that we've built out through partnerships. And the second step is basically what we call alignment, which is where the company that builds the model typically will choose what they're trying to achieve. And for most models out there, they're assistants. So the core goal is called instruction following. And it involves having the model learn to take in an instruction. How tall is the Eiffel Tower? Please give me the correct answer. In our case, we have a very different kind of alignment step because we do use experts and we're specifically aligning to have helpful long-term trajectories. So whereas with a general purpose assistant model that's aiming to solve your problem in the next message to give you the answer, our model is trained to create helpful trajectories, lead towards good outcomes, good conversations that specifically drive autonomy, competency, and relatedness, which I could dive into in more depth. But in practice, what that means is for an assistant, if you were to say something like, I feel angry, it is an assistant is trying to solve your problem. So it'll say something like, here are 3 things that you can try, kind of like a Google style answer. If you're talking to Ash, it's much more likely to say something like, so, why is anger a bad thing? Like what's the problem? And it's not that there is or isn't a problem. It's that it is trained based on trajectories. And so it is trying to open up a good conversation that might lead you to be like, of course it's a problem. It keeps getting in the way of my life. And it's like, okay, this is really interesting. Let's talk more about that. I can go on for hours talking about how LLMs work, but I think those are the big fundamental pieces, which is just, we take this bottom piece, which is just like an architecture modeled after a brain. We train it on a huge amount of data. We align it for a specific purpose. And the process is very much fundamentally different than a human. So yes, I think though it can behave in a way that is intentionally very similar to us because it's trained on our data, it's obviously quite different. But again, I don't know if that gets at the whole consciousness thing.
Yeah, well, and you know what? I don't expect you to be able to tell me whether AI, has consciousness or can have consciousness. That's still above all of our pay grades. So you're describing a system that is really good at talking, which is pretty much what it is, to understanding, and then
Well,
it's a language model, right?
I think there's a piece that people sometimes miss here, which is an assumption that because it's trained on language, that it's surface level. And I don't think that is the right interpretation. So the classic example here is like, if you train a language model on an Agatha Christie novel, and like at the very end, we find out who was the murderer, the model does need to predict who the murderer was. And the way that you do that is not by being surface level and just knowing how to spout words. It's by going deeper and understanding for itself, like a mental model of what's happening in the book, to be able to make appropriate predictions. Right. So I think the thing I would say is it is language and how it interacts, but I think there are also really strong cognitive science theories that basically rely on language as a fundamental way that our brain works. And so there is this way in which, what if language is the way that it learns, but fundamentally it really seems like there is something deeper, still language, but it doesn't mean that it's kind of just language. Like language actually is an extremely deep thing.
Language is how we connect ideas. The reason why I said the word talking is because originally therapy was conceptualized as a talking cure. That's what Freud called it. Eventually we came to understand it differently as more of a, kind of split, but more of a relationship cure. But Rachel, I'd love to hear any reflections you have about LLMs versus, the nature of therapy.
Yeah, I do think that the issue isn't really whether AI will ever be conscious. I think the issue is how people behave when they believe it already is. And so we're seeing that in terms of these subreddits. And I'm kind of deep into the understanding of how people are marrying their AI. I mean, there's a whole road down there. And I just want us to be mindful that all of this isn't future. This is all happening right now. Like, we are now talking about hundreds of millions of people who are using AI for emotional support. I mean, ChatGPT has 700 million weekly users. And, we referenced the Harvard Business Review that companionship and therapy is the #1 use in 2025. Also, Centio University just came out with a study that AI may be the largest provider of mental health support in the US right now. This is staggering. So I think our conversation gets to shift from should this be happening or not to let's get ahead, because this is already the reality. And instead of going from hundreds of millions of people using it, we're going to be seeing billions of people using it. How do we build AI that is going to be safe and supportive for that kind of context? Right now, when we look at general purpose bots like ChatGPT, they aren't built with kind of this underlying safety guidelines and guardrails for mental health support. Sam Altman has said this. OpenAI is like, don't use this for mental health support. And they're now trying, as we see, to band-aid on top of it some of these guidelines and guardrails. This week, OpenAI has said they're going to build a network of therapists in order to kind of help with what's going on in terms of the way people are using ChatGPT. So I'm of the mindset that we should be, especially as mental health experts, really helping create AI that is fit for purpose. And what that means is that it's going to be used in a way where there are crisis protocols in place, where it's trauma informed in order to give kind of body-based prompts that help de-escalate people, where there's a one-touch access to a human hotline, things where we can do cultural competence and bias mitigation. I mean, I could go on and on in terms of the way I think that these should have certain ethical protocols in place, but it's really important for us to differentiate a general purpose model and a fit for purpose model, because if people are already doing this, I believe they should be using the ones that are going to be trained with some guidelines and guardrails in place.
Couldn't agree more. I think the other thing I would just add, I do want to push, like, given the opportunity of the audience, I want to push this topic a lot further. I think, to be honest, I agree with everything that you said, I think, Dr. Wood. But I think my concerns actually, and I think, Megan, you've gotten at the big concern around relatedness, just connection to other people. The three concerns that I had in founding this company were autonomy, competency, and relatedness. And if you guys know, that's from self-determination theory. But I think the three of them are exactly the things we should be concerned about with AI from my eyes. Like, I think those are the biggest things. This goes well beyond how do we handle people in crisis. This is autonomy on the side of, if you have something in your pocket that can always make decisions for you, you do learn to defer decisions to the AI. You do become less autonomous. You can imagine if you went to your therapist and you said, should I break up with my boyfriend? And they were like, yeah, he's toxic, you should leave him. That would be a bad therapist, because they're taking away the person's autonomy. But at least you're limited to only seeing them on some cadence. If you could actually pull that out at 2 a.m. and get that answer and break up with your boyfriend, you really lose that sense of autonomy. You lose that sense of competency. And I think this is something I've also heard quite a bit from therapists, which is if I say you should break up with your boyfriend, I'm also taking away your sense that you are the best placed person. Maybe the better answer would be something, you're actually the best placed person to make that decision. You're the expert in your own life. You know your situation. I want to support you, but there is no right decision here, and I'll never know as well as you do. AI is a genius, right? There is this sense that you're talking to an emotional genius, and there is a way in which you increasingly feel inferior, not just on the mental health aspect, but also if you're a fifth grader and it can write your essay better than you can. And on relatedness, it's perfect if it's constantly validating you and it's the perfect friend and never talks about itself. Of course, there's a huge threat that it replaces people. So I think from my perspective, those are the biggest three things that I wish this conversation was always about. I want people to be constantly thinking about autonomy, competency, and relatedness. And where I completely agree with you, Dr. Wood, is it feels a Band-Aid when we're talking about the questions about escalation. When I worked in that space of escalation for the longest time, we were massively under-resourced. We work right now with an organization in the UK that has ChatGPT referring people to them, and they can't handle the load. And they are just, frankly, we don't have enough people to handle all this. We, spend our time with insurance companies, with employers that are just, how am I supposed to give access to all these people? We've been really fortunate. We've been super happy to see how many people have used Ash and then went to therapy and have been able to go through a process where they're able to identify what kind of problems do actually need people, or, what kind of problems do benefit from talking to your parents, talking to your friends. I think that AI can be intentionally built with these three values. That's what we've set out to do very explicitly. These are the three things that we said from day one are the core values that if we achieve nothing else, but can help people feel an increased sense of autonomy, competency, and relatedness, we've achieved our goal.
Yeah. I think this autonomy question is really a big one. And I had sent you a list of questions in advance, but this morning I added one because NPR had an article this morning about AI in therapy, and it led with a story about a woman whose therapist stopped taking insurance. So her copays were $30, then she was going to have to pay $250. So she turned to ChatGPT, and she told NPR that now when she wakes up from a bad dream in the middle of the night, she can just talk to her therapist on ChatGPT, and that's something that no human can give, which is intentional because boundaries are very important. And how are you? I would love to know how AI should be and how you are thinking about intentionally limiting AI, which, to be honest, even using the word therapy kind of rubs therapists the wrong way for that reason, making sure that our conceptualization of what AI is stays in its lane.
Just to say, I think that's fair. We've been experimenting. We're, of course, early. I would mention we've taken away the word therapy. We experimented with it for a while. I think that you're right. I think it sets some interesting questions, which is what this might, but just getting to it's a great question. So one thing I heard I think this was yesterday, someone reached out to me. They gave us some feedback and they were like, I was having a lot of trouble sleeping. I reached out to Ash in the middle of the night and Ash said, okay, what's going on? And then I dumped out all the things in my mind. And then Ash said, got it. Maybe you can get some sleep and we'll talk about it tomorrow. And they were like, this thing really helped me sleep. And I think that kind of added, so I mean, the main thing that happened there, just to be clear, was Ash kicked the person out. And that has been an approach that we've taken. In the early days when we first got started, we had a timer on sessions and we had the idea of scheduling and a frequency and all that stuff that makes sense with people. None of that makes sense with AI. Conversations with an AI are radically different. They are not the same conversations. You hear classically like people open up after like 8 to 10 sessions with a therapist. With Ash, people open up usually in the first 5 minutes. So we have a lot of people where Ash says, hey, ready to get started? And he's just like, yes, by the way, I'm gay and I've never told anyone. It's different, right? You're not taking the same risk as you would with a human. It's not judgmental. Your problem's not going to be solved by having said that out loud for a second. But something opened. There's a very different place for this technology and where it functions. On drawing limits, though, to specifically answer the question, yeah, conversations should not go on forever. And the approach that we've taken is to try to identify, based on the conversation dynamically, it's not a constant thing. Sometimes it's 5 minutes in, if it's the middle of the night, sometimes it's an hour in, but get to that point where you say, you know, it seems like we've talked about a lot today, and I would love for you to get a chance to like integrate this into your life, to talk to other people, honestly, to get some sleep. I mean, even just sleep is a major aspect of neuroplasticity and change. So you need to sleep. You're not going to stop your whole thing in 8 hours straight. And so Ash might say, let me just ask you one more question and let you go.
I'd love to jump in here, particularly on the agency issue. I know we went a step ahead of that, but I was like, oh, I have many thoughts here. Okay, let's back up and realize why this idea of agency is foundational for where society is headed. Because if we don't get this right, our kids and their kids are going to have fundamentally different relational muscles than we do. So part of what can, let me go at this 2 different ways. First of all, this idea of agency is micro abdication after micro abdication can strip us of our own critical thinking and our ability to decide what we want to do with our life. And I think that particularly the younger generations are slightly more vulnerable to thinking, oh yeah, I'll just have ChatGPT tell me what to do. And that this is going to be really crippling for society on a large scale over time, if that's the way that this heads. That's why I don't think that LLMs should give advice. I think they should solely support the decision making and the critical thinking of the user through things like questioning and, hey, let's walk through a process of helping you come to your own decision. That support should be there, as opposed to kind of a yes man answering machine. The other thing here that's important is making sure that chatbots help practice relational skills as opposed to atrophy relational skills. And what I mean by that is you don't really have to practice patience or negotiation with an LLM. You maybe text a friend, they don't get back to you for a day, like you have to be really patient. An LLM is going to get back to you right away. So there's this erosion of some of our bidirectional relational skills that can happen over time. And again, that can really, looking down the road at society, be crippling. So what I like to see is when LLMs are actually helping us practice the hard things, and then really, ushering us back into the arms of other humans.
I would just add, I think you're talking about practicing with AI. I would say some of we were talking before about mechanisms. I mentioned one of our top results was just on average, we know that general purpose assistant models make people more lonely, more subjectively lonely, and also have fewer real world connections. And we also have seen that with Ash, people do have more valuable, meaningful connections in their lives. So what are the mechanisms there? A lot of what we've pushed for, or what we understand it to be so far, has been practice. And it has been, some of it is behavioral activation, just like encouragement. Some of it is building resilience and having like oh, you went to the party and didn't have a good time. Is it possible that you can still go to a party tomorrow and you will have a good time? And talk through those kinds of things. Mindfulness. A lot of it is also just helping people build basic skills, which is to say, I hear that you really want to have this conversation. And the person's like, yeah, but I have no idea how to have the conversation. And sometimes there are those tips like, well, let's start with this. How do you feel? Maybe we can start with a sentence like, I feel. And there are sometimes just actual, very pragmatic ways in which the LLM, rather than serving as we're going to solve our problem right now, just serves to help people feel comfortable developing those real world relationships, handling those moments. And if the conversation doesn't go into, let's try to figure out what's wrong with the other person behind their back, and instead it's like, let's figure out how you can go over and approach that person. I still suspect, I just did this program a few weeks ago where I sat in a room talking about feelings with 13 other people for many, many hours. And I don't think that there's going to be a replacement for that with AI, just to be clear. Like, I think that fundamentally a lot of what you're talking about that I'm completely in agreement with has to happen in the real world. And I'm hopeful that, we can have AI help people, encourage people, give them the skills such that they can have those really valuable interactions, maybe with a therapist, maybe with a group of people, maybe with their friends, maybe ideally with their community.
I think what you're describing here, Daniel, which is AI not as a alternative to a human therapist, but almost like a gateway therapist or an interim therapist,
100% yes.
is not necessarily something that mental health professionals would be opposed to. But again, like I mentioned earlier, the idea that it might replace therapists is very alarming, and I think you understand and agree with that. So I want to ask, how can, we talked about ChatGPT announcing that they're going to do a network of therapists, which is a good start.
Well, just to be clear, there was, as far as I understood, it was more of like a leak about a discussion.
Okay, so it wasn't even official. Of course not.
I've talked to, and there's extreme skepticism that this will ever happen. We looked into it, by the way, for ourselves, and it is extremely expensive. It would mean for our product that we would be enormously more expensive to run. That's why we've never seen a mental health company take that approach. And I'm extremely skeptical.
To run a network,
to be able to offer some sort of path where you can just like link into a therapist, like just have a therapist jump into a conversation or something.
Oh, gotcha. But I mean, I'm working with the company right now to build out a directory, where therapists have self-identified as like, I'm available, I'm in your area, I can help with these issues.
And we also, I love those. I'm extremely supportive, but we also have to acknowledge this is just incredibly hard. I just meant, like, there is a problem and we need to address it, which is the problem of just making sure people have access to therapy. And I think one of the things that we have, had a lot of success with is, to be honest, not just a directory, but just talking people through what is the process of seeing a therapist. How would I know if they're a good fit for me? And sometimes just telling people, I know that you went to a therapist and it was a bad fit, but on average, people need to see 3 therapists to find someone who is a good fit. So that's totally normal. And if they didn't get you, that's fine. There are a lot of other people, there are a lot of other styles. Here's what the process might look like. Actually, talking through those I'm just mentioning, I think can be really impactful. I would just have a lot of skepticism on the idea of trusting a company like ChatGPT and expecting that they're going to solve the shortage of mental health providers that we've had for 60 years.
Oh yeah, absolutely. But I mean, I have already spoken to a lot of therapists, well, not as many as there should be, who are all of a sudden I'm getting referrals from ChatGPT. So the idea that AI would serve as an on-ramp for real life therapy is not, it's already happening. I think the question that needs to be answered, though, is what are the indicators that say that the problem is above the heads of an AI, and how do we facilitate that connection to a real human? Rachel, what do you think?
Yeah, I think that part of where we're headed in all this that's currently happening, but going to proliferate in the future, is more of a hybrid model. So and there's been studies done, especially with Gen Z right now, that they don't want only a chatbot and they don't want only a human therapist. They actually want both. So what they want to see is some sort of, I see a human therapist and then this chatbot kind of supports me in between sessions. This is why I think it's critical that we are having conversations with clinicians to understand how, you can really engage in this type of conversation with clients. In terms of clients, many of your clients are already using ChatGPT or something, or Ash or whatever they're using something like that. And so how do we actually open up a conversation if somebody maybe feels they don't want to tell anyone that they're using this for emotional support? We should be a safe therapeutic space to process some of the patterns that are arising in the chats with the LLMs, and even kind of enlist the LLM to support the work that's going to be done in between sessions. Like, hey, we identified these patterns. Now, in the next week, these are some very specific exercises that can support you growing in the work that we're doing.
I have some, thoughts and feelings around this. I think part of it is like, of course there is the picture, and you're obviously clinical professionals, and we should talk about what happens when people are in that space, when they are accessing therapy. I definitely hear the question a lot of like, as a therapist, how should I handle the fact that my patient's using ChatGPT, all those kinds of, how can I work well with this? I also think that somewhat this misses the bigger picture. So in the US, my best understanding of the numbers, everyone has different numbers, but if the US were perfectly evenly distributed, there would be about 1,500 people in need for every therapist. And I think there's the question of like, should we have more? Yes, we should have more. Yes, we should have more access. But there's also the question of, should everyone be going to therapy? And I really appreciate, Dr. Wood, what you said on what are those indications that you should. I hear a lot from therapists when they talk about ASH. On my way to work, I pass 10 people every day where I'm like, I wish I could help this person. And I can't because I have a full workload. And the reality is I can't help everyone. And I also wonder, and I think this went to what you said earlier, Megan, also about the way in which we need to help people through community, which is just those questions of, I don't want to conflate necessarily those clinical use cases that we're talking about. The kind of topics people talk to ASH about largely, like I mentioned, like the kinds of things talking about things like grief and family and relationships, those are not necessarily the kind of things where we can have like a mental health system where we say this should be you should be going to a therapist. Like the reality of it is our mental health system won't pay for it, right? We don't have enough therapists for it, but we also just, the vast majority of those people won't have a medical diagnosis. Their insurance company is probably not going to cover therapy for what they need. And I think there's the question, there was a great article on Friday by Hemingway Report on just the question of, should all of those people actually be going to therapy? Like, actually, is that the solution? I think I'm just mentioning this because of where we sit in the system. And I know there are other companies that I think are doing fantastic work with trying to work with therapists. There are questions about, can you decrease the duration of therapy and have people come in prepared with the kind of questions that they want to talk about, or practice things in between sessions? Are there great hybrid models? But I also want to mention, I think where we sit and where we think is incredibly important is for the vast majority of the population who just have access to nothing.
I think that's very true. And I think that most therapists, though not all, would agree that while almost everyone could benefit from therapy, that not everyone necessarily needs therapy. But I think I want to hold this to my original question, which is what responsibility do AI companies have to redirecting to a higher level of care, which comes with its own set of questions. But also I think I would take it as far as, Dan, you said you supported regulation. Do you think that should be something that is required, that ChatGPT should be held responsible for not dispensing mental health advice and instead redirecting?
It's so funny. I spend a lot of time with the folks from, the therapy networks, the Alma, Spring, Headway, et cetera. And, the people that are trying to build directories, I think that this is like a far more, let me just start by saying this. We had someone recently who sent us a letter talking about domestic abuse. It was someone who came to ASH and they were going through a domestic abuse situation. And as we all know, you can't solve domestic abuse with psychoanalysis. It was very, sorry, I'm getting a little choked up. But basically what they said in this case was basically like ASH was able to talk to them just about what it would look like to access resources. And ultimately what they did was, as far as I understood, they went to a not-for-profit and they were able to access a resource that was specifically built for this. And their comment was like, I wouldn't be alive today if it weren't for ASH. Obviously, ASH did not psychoanalyze them and solve their problem at all. All it did was redirect to another resource. But I think the challenge here is a lot deeper, right? In this case, I imagine that what they're referring to is some amount of shame, of fear, of just trying to think through. And we're talking about something very deeply pragmatic, and it's very possible a lot of people are in those kinds of situations reaching out to ChatGPT tomorrow. I think there is incredible importance to just being able to access resources. I did an internship a while back as a social work intern in the city of New York, focused on helping people who were struggling to find housing. And the kind of problems that people needed were not the kind, again, that is just solved by it was access to resources. So I just want to say, I think this is a massive problem. I think it's in a hard one I just want to make sure it's not, I assume anyone watching this has struggled to find access to therapy. Personally, I have, my dad's a psychologist, my mom's a social worker. I went through a really tough time and I had everything going for me, and I still really, really struggled to find the kind of help that was helpful for me. And, I eventually did get what I needed, and I'm really glad about that. I don't think everyone does. But I also just want to say, I'll tell you, we do refer to resources. We have some partnerships with organizations where we push to them, give people guidance. But I mean, the process here is hard. I think there's some sort of simplification that I worry about, which is just get someone a therapist. And I'm like, I would freaking love to, but what if you're not insured? You know, there are crisis resources, don't get me wrong, right? There's 988. It's awesome that we have a resource people can call when they're in crisis. But even then, when you talk to 988 and you say, my problem's not a crisis, it's chronic, this is a long ongoing thing. I think we need to do a lot. Don't get me wrong. I also want to make sure that we're not taking away resources. And what I worry about, speaking very frankly, is just the way in which we have this kind of sense that if we're going to introduce new resources, like one new thing to solve one new problem, there's an expectation that it's going to solve every problem out there all at once.
Dr. Wood, I want to give you an opportunity to, if you have any thoughts. You're muted though.
Yeah, thanks. Daniel, yeah, I mean, you're speaking to this larger thing that Megan alluded to earlier in the conversation, which is not everybody needs therapy, but everybody needs community. Like everybody needs a neighbor, that you can talk to, that you can lean on, that you can call when there's a problem. And so I think there's this larger thing of specific use cases need therapy, and yet that's not the answer for everything. The answer is for us to be building communities that are really going to kind of bolster all of us in the midst of really challenging times right now.
Yeah, our clinical lead, Derek, he's sometimes refers to what we build as what we really need is a cultural shift. What we really need is a cultural phenomenon like billboards. But billboards aren't enough. And what if we could use AI as that platform to just kind of go to each person individually and say, if you're going to survive in this changing world, you need a community, and we want to help you get that.
I completely agree with what you guys are saying. I just want to go back one more time, because I don't think there's any therapist who disagrees that there's a huge need for mental health support. I mean, I'm all for a self-help book. CBT is just as effective when you're applying it to yourself from a self-help book. That's why I'm like, AI could probably take over that role. But Daniel, you mentioned going to work and passing 10 people that you wish you could help. I imagine they're exhibiting outward symptoms of mental illness that probably an AI is not up to. Even when I was actively practicing, there was oftentimes where I would have to make a referral and facilitate that referral because it was out of my scope, and ethically I could lose my license if I did not facilitate the safety of that person passing to a higher level of care. So, to take on the mantle of AI as therapist, or even just borrow the term, like how can we make sure that it is upholding these ethical and safety standards that therapists are trained in?
Yes, 100%. So, I mean, a big benefit in the context of AI is that we have, such deep access to the conversation. Like you're able to control exactly what happens. For us, we've developed 7 layers of guardrails that control to ensure that the AI is staying kind of within its lane and the kind of stuff that it can talk about. And then also just identifying anything that can indicate risk. Risk can come in a lot of different shapes and forms, the most obvious ones being around suicide and self-harm, but there are quite a few others that we have to think very carefully about. We've developed quite a bit in terms of our systems. The way we've largely tried to frame it is just make sure that the AI stays in its lane. I think that there's the questions of referrals that I know you're bringing up. I don't think that, like, for a technology like ours, that we can effectively do referrals. I'm not saying that that's not something I wish we could do. It's not something we can't do in the future. But I think that it would mean largely, in some ways, diagnosing people and deciding what's right for them. And I'm not sure that our technology is yet at that place, right? I think I talk about this sometimes. I won't go too deep here, but sometimes talk about like the levels of AI therapy. So sometimes people think of AI therapy in terms of titles, as if there's going to be a psychologist and a social worker and a LCSW, or there's going to be, LMHC, and there are just going to be a bunch of different abbreviations. And there are different jobs to be done, especially when we're talking about people, but it's not in a clear hierarchy of, because your problem is too hard for mine, of this level, I'm going to hand to the higher. That's not really how it works. With AI, I think there is a bit of this confusion of what if AI is not yet at the level of therapist. And I think that's kind of a weird framework. When people are looking for therapy, they're often looking for a certain kind of conversation, a certain kind of help. I think there is another way to look at this, which is in levels and capabilities. So ChatGPT, we think of as a level 1. It's capable of helping people. It's capable of validating, and it's capable of information, right? It can tell you stuff. We believe, a step up at level 2, which is able to challenge people, able to use evidence-based techniques to go down a path. But what it's not able to do, and I think this is kind of the level 3, is make judgments on behalf of that person. I definitely don't think that we're at a place where we can be making judgments. And I think that limits our ability, in particular, to help children or people who are not competent to be making decisions to themselves. We, for example, with children, we just draw a very clear line. We will just block anyone. We don't support anyone under 18. There's serious mental illness. there is, diagnosis, those kinds of activities that we think of as our 3, 4, and 5. We stay fully away from them just because we don't think the AI is capable yet. So I want to be careful that when you talk about, can you identify, is this person, I think there are boundaries you can set in the kind of behaviors that you can have. If there's suspicion that this person might be experiencing psychosis, you don't want to be validating. And I don't mean you don't want to validate something specific. I just mean you want to be really careful on validation generally, because you have no idea if you're about to be validating something that's a delusion. So rather than kind of draw the line and say, I've identified that you are psychotic, you're experiencing psychosis, this is what you need. What you want to do is identify, okay, there's something weird here. You need to just talk to people. Like, is there anyone around? Is there anyone in the house right now that you could talk to? So that's kind of where I would think. I'm not sure if Megan, I don't want to be evading the question. So if I'm not answering.
No. I think you're getting the gist of it. I think, these are the questions that most concern therapists. So I appreciate you doing your best to explain your thinking around them. Dr. Wood, I would love to hear from you just about, this wasn't on my list of questions, I apologize, but I'm listening to Daniel talk about the limitations that they put, I assume in the form of disclaimers, that they don't serve children, they don't serve certain.
No, we have 7 layers. We have classifiers that monitor what the user says. So that I don't want to go into, we do want to keep this a little bit black box so people don't.
Oh yeah, totally. Yeah.
We have classifiers that monitor what the user says to indicate. So for example, word salad is like the kind of thing that might indicate that the person's experiencing psychosis or
gotcha.
Cameras a lot. We also have classifiers on what the AI says, just to make sure that we have limits. We have red team tests, we have prompt-based tests, we have pop-ups. We have quite a bit in the context of, anyway, so for each one of these, I'm not just talking about disclaimers, I'm talking about.
Okay, cool. More than that. So I suppose my question for you, Dr. Wood, is more along the lines of disclaimers and whether it would be a good idea or healthy for AI to have in itself embedded regular reminders about its own limitations and the nature of who you're talking to.
Yeah, kind of, I would call it disclaimers of non-personhood. Essentially, it's interesting because New York has just passed something that comes into effect on November 5th that is requiring AI companions to have a non-personhood disclaimer. I think it's every 3 hours, if I remember correctly. And so I think we're seeing some things along those lines where states are going to come together and kind of give these different things. It is really important to be reminded, especially if I don't know if you've ever done Ash or any other AI with voice. If it's a good voice and voices are getting better and better, you can forget that it's not a person. So I think it is helpful to bring a reminder in that space. And also another interesting thing, and part of this, has contributed to some of the headlines we've seen that have been really tragic, which is, and Daniel, you might have more to say in terms technically about this, but the longer chat goes, the lower the model accuracy, meaning that kind of the longer a chat goes, this is what ChatGPT was saying, the model isn't quite sure that it's like wandered into like bizarre conversational territory. And so I think there are these disclaimers that need to be kind of packaged around all of this of non-personhood and even reminders to take a break. Like, hey, have you been outside? Like, is it, like if it's rainy or sunny, like go outside, or have you gone to
some grass, as the kids say.
To a clerk? Yeah.
Yes, fully in agreement. I would mention, by the way, on the long conversation thing, though, that is the reason why you need guardrails. Like that is the reason to say that once you've said, like, we're confident this model will never do a bad thing, you also need an additional layer, right? It's like a Swiss cheese model. You want to have those different layers of saying, like, each one, we can tell you it's perfect, but it's obviously not. And so let's have enough layers that we can be additionally confident. And that's, I think, what ChatGPT was missing there.
All right, we didn't have a chance to get to all of our questions, but I think we probably have enough time to do one more. So let me see if there's any. Okay, I think this is the one that we care about, that clinicians will care about the most, which is just talking about what accountability model might make sense. I know, Daniel, you have strong feelings about ChatGPT being used for mental health. So I would love to hear, not necessarily for yourself, but also, for non-AI models. And Dr. Wood, what do you think as well? So I'll let whoever wants to start with that one.
You gonna have me go first, Daniel? Is that what that nod was?
I can, yes. I've been going first a lot one day. Unless you'd like me to, I have plenty to say.
No. I think that let me just give a little landscape of what we are seeing right now. I don't know if this is the best way or not, but California has brought in now a pathway for litigation. And so essentially something like this, usually when there's a bit of financial pressure, maybe is what can speak the loudest. I'm not sure. But bringing in, there's a pathway now for people who have been harmed by chatbots in some capacity, that they have a pathway to litigation. So that's some of that oversight that you're talking about. I think that that's not an answer for all of this. I think that that is one avenue for this. And that's at least what we're seeing happening right now.
Yeah, I mean, I would say, just to start, there's this assumption when it comes to how to approach AI. Sometimes we think a little bit too much like humans, and we have the sense of maybe the AI just needs to take a test and then it will get its title of therapist, and that's going to be. And I think there's some quiet mental model we all have that. Except that, of course, it can't. That doesn't make any sense. If there were a test, AI would pass it today. Doesn't mean that it's actually good enough. The benefit that we have that's quite different from the way that we practice with humans is that we have no visibility into what goes on in the conversation with humans. We have far more ability to be keeping track of what's actually happening, to be ensuring that we're taking rapid steps to improve the model over time, not necessarily an expectation that it's perfect on day one, but an expectation of accountability that we will always be on top of it and that we can constantly be improving on every aspect. I would also mention, on the side of financial accountability, I mean, of course we're accountable, yes, financially speaking. For a company like us, I think there's also a piece that's less appreciated. So we are a venture-backed startup. It's public at this point. Our lead investor that is Andreessen Horowitz. There's some expectation, I think, when you're a venture-backed startup, or some sense of you're trying to squeeze people for profit and make all the wrong decisions in the short run. And I think that it makes sense when you're talking about a big company like ChatGPT, where their main goal is artificial general intelligence, solve all of humanity's problems, that it's like mental health is like a thing off to the side that's just not all that important to them. For a company like us, the goal fundamentally is to help people with their mental health. Like, that is the outcome that we need to achieve. That means that these kinds of problems are catastrophic for us in a way that they're not for a company that's not focused on this. And it also means that for our investors, this is making sure that we are actually helping people is incredibly important. So it's not just on the negative side of what goes wrong, but actually holding accountability to making sure that we are actually helping people, that we're having the kind of outcomes that we want. In our case, that means improving and increasing real life relationships and connections, and not decreasing them or replacing them, not leading people to, making sure that people feel more autonomous, more confident, not less. And that kind of accountability matters. I'm just mentioning, of course, there are the ways in which we need to introduce systems and people need to know that we're accountable. But I also do want to mention, from the way that we spend time with our board, VJ, who led our round at Andreessen, was a professor at Stanford for 20 years. We're talking about people who generally have the very strong opinion of, for this to succeed as a company, first and foremost, it needs to actually be able to help a lot of people. And fundamentally, if there's a world where we do help a ton of people and it's not a great business, they're okay with that.
I think that even the most enthusiastic capitalists agree that there are certain industries that need a proactive regulation rather than reactive through litigation, which is the reason why we send doctors through med school and make them get licensed rather than just wait and see if they kill someone and then they go to jail. So, but I also understand what you're saying, that a test doesn't make sense. So what models would work for holding and I know you'll probably get fired for suggesting regulation if you're VC backed, but I'd love to hear if you have any thoughts on that.
I wish I could answer in this short time. What I would say is we are spending a lot of time right now with folks in the government, with folks in not-for-profits that are trying to organize better standards. I think we do have a concern about the wrong kind of rules being implemented, but I would mention Utah's law is a good example that we're very happy with. The kind of stuff that Dr. Wood was talking about, we're very happy with. I think there's a lot of work towards creating better standards. And for a company like us, it really benefits us to create these, frankly, because we've spent so long developing our systems. And it does, in some ways, create a differentiation between a company that is investing hugely in this space, that is very much dedicated to helping people with mental health. The biggest concern I would have, just to say very frankly, on regulation has been, there is the law in Illinois that's passed that you might have seen that completely cuts out ChatGPT, just completely exempts ChatGPT from any of these rules. So they establish a set of rules that only affect a company like us because we intend to help people with their mental health, and then create this whole cutout to say, if you don't intend to help people with their mental health, you're exempt. And that's just such a cheap, lame way for lawmakers to pretend that they're making a difference in the space and creating rules, but in practice, leaving out the company with 700 million weekly active users.
Dr. Wood, do you have any thoughts on that?
Yeah, I mean, I think this area is so nuanced. That's why I love these conversations, because there's not any kind of general sweeping black and white here, and it's evolving so quickly that I think when you see a headline of regulation on AI, some people may be like, yeah, woohoo. And yet when you look deeper into some of these things, ChatGPT, again, is used mostly for mental health support, and there's no regulation there. So we really need to be mindful in how we are helping kind of give space for companies that are trying to do this well, and then companies that are general purpose models. I just think there's so much nuance here for us to be mindful of.
I would just end by saying we would love to include more people in this journey for sure. I think we're early, and so there's not a lot that we've put out yet. And we're right now actively working to share a lot more of our thinking very publicly, to be, our own critics and make sure everyone knows the kinds of questions that we're asking. I had a meeting on Friday for about an hour with our whole clinical team that was concerned about one particular issue that I'm not going to go into depth on here, but I think our feeling coming out of it was like, wow, I wonder if we're the only ones talking about this right now. Yeah. And it would be absurd if we are, because every other company that's facing these kinds of problems needs to be talking about this. We need to be talking about it together. Awesome. So I would love to include more people on this journey.
Yeah, we would love to see that happen as well. Well, thank you guys both so much. That was everything I hoped it would be. And hopefully we will maybe be able to do this again in the future. And the recording will be available to FitCheck members if they want to watch it, if they missed it, conversations in the group. And I hope you both have a wonderful day.
Thanks, Daniel. Thanks, Megan.
Thank you.
Thank you.